the Safe Staffing Act that we have, it's called the Nurse Staffing Levels Act 2016. Now, if you look at the actual legislation in the Act, it doesn't prescribe that ward sisters, charge nurses should be supernumerary. But as with all legislation, what you actually have then is an explanation about how it works, and then for this legislation, the statutory guidance that sits alongside it. So the word statutory is important, that means it's part of the law. And in that statutory guidance, it's really clear that ward managers, those are sisters and charge nurses, have to be supernumerary, i.e. they must be in addition to the staff required to care for patients on a day-to-day basis.
When we talk about ward managers, that can be used as a ward sister, it can be a charge nurse, and all those titles are interchangeable. Patients right across Wales know that the ward manager is in navy blue. They know who's the leader on that ward. It's about patients feeling safe.
Evidence shows that you put your ward managers supernumerary so they can supervise and do all the other duties that they need to do, and you will not only improve patient care but you will also reduce mortality in clinical areas. And that's a really stark thing to hear about, isn't it? You know, health boards are aspiring to it. In our view, they need to get on and aspire.
The role of a ward manager is a very complex role.
So they're managing the workforce, they're managing the pressures of the environment, they're managing the budget.
Fod yn gyfrifol am hynny 24 awr o'r dydd.
Overall, it's my responsibility to look after everyone.
And that means being able to support my staff so that they can then go and give effective care to the patients.
You need to delegate what needs to be done so we ensure the patients have the care that they need.
It's the person that supports the staff, both clinically and personally, professionally.
Facilitating discharges, helping the flow of patients through the hospital.
And help guide the doctors and lead the doctors of what needs to happen next to progressive discharge.
They're managing the budget of the ward, the agency nurses.
The delivery of effective care for patients.
I think the ward manager role has to be supernumerary. It's a crucial central role for patient recovery, and it has to stay supernumerary for our patients to actually have the best outcomes.
So we're the constant person that's on that ward, we're the continual part of the ward really.
Leading from the front, I think it's really important for the ward manager to be visible and to be in a supervisory capacity.
Mae ward managers yn pwysig achos maen nhw'n arwain y tîm. Maen nhw'n dod ar tîm I gilydd.
So being visible in the ward is very important for patients and staff, and that's what I feel as being as a supernumerary as well as supervisory role as a charge nurse.
There are the odd occasions when we're low on staff where I have to go into the staff numbers, and that's fine on a short basis, but realistically I can only do one job, and a ward manager is a full-time role on its own.
The day just flows much better. You know exactly what's going on with your patients. You can accompany doctors on their ward rounds, and then you know exactly what the medical plans are.
The oversight of the clinical effective care that's been given. It's the ability to be strategic. It's the ability to implement processes and quality improvement programs. It's the ability to make sure that my staff are supported and they have the right skills and knowledge to give the right care. It's about clinically leading to make sure that I'm an expert on hand to actually support and drive.
To have time to teach and accommodate all the new people coming into the ward as well.
The ward manager as it stands today is so important in ensuring the patients get good care on our wards, good high standards of nursing care.
When I'm in the staff numbers, it's very, very hard to run the ward properly because I'm taken away from my core job as a manager.
So it's about quality improvement initiatives and about processes that I can do because I'm not in the numbers.
It's driving up those standards. It's driving up those standards and supporting the nurses in doing so.
I think wards would be in a difficult position without the ward manager.
It's been a really challenging time with COVID, and everyone's feeling a little tired, and I think it needs a ward manager that's got a positive attitude to keep bringing that to the ward and keep bringing that to the nurses to keep those standards up.
So it's been a very challenging year, as it has been for many ward sisters. I was only new into the role when COVID hit. I'd only been appointed 3 months for the permanent role prior to it hitting.
I was included in the numbers most of the days, I think. So my supernumerary capacity as a ward manager I wasn't able to fulfill that role because most of the days I have to be in numbers to support the staff as well as the patient.
And as things got busier and we went into the peak, I was pretty much a member of the team on the ward. I had a team of patients myself, and that was consistent throughout that peak.
I've had to provide the team with much more support than they would normally have needed, particularly with the change in role manager that they experienced and then the COVID pandemic.
I had a novice workforce, so my role had to be on the floor so I could support those nurses, the patients that we had were very acutely ill, and I had to make sure that they knew how to deliver the care that we needed to give.
I guess it kind of fell on me to show junior staff that as long as we're using the right precautions and as long as we're safe, we're reducing the risk to ourselves, and we have to do it.
A lot of my role was a lot more supporting of the team, a lot more supporting of the anxieties that the team had. And because we're a forensic secure unit, patients locked away, we're increasingly needing of our support.
We had such short staffing while COVID was rife that I had to become part of the numbers. That meant that I could only do one job, which was to provide quality care, and I had to stop doing the management side, which meant that we had huge staff with huge anxieties, quite understandably, about a pandemic and being in the middle of it.
So I guess I was kind of leading by example, being a role model, showing them that, yeah, actually I am a little bit scared myself, but there are patients at the end of the day. They're vulnerable, they're here on their own, and we're all they've got.
Yn bendant, y staffing sy'n ni'n yma, ysa hwnnw'n gyson, sy'n ni'n gallu rhoi yr gofal yn gyson. A gwybod bod gynna ni'r adnoddau yna I allu rhoi y gofal gorau.
I feel the admin support is very important for the charge nurse as well as the ward sisters. So most of these jobs which can be done by an admin support, and admin support is very crucial for supporting the ward sister as well as the charge nurse.
It would be beneficial that we could have support from IT estates, telecoms, to be able to get the wards up and running safely, because it felt like we were constantly chasing our tail, and not being able to print a handover sheet was very challenging.
I think it's really important that the staff are supported. You know, if happier staff lead to happier patient outcomes, which lead to better care.
The Francis inquiry, I think the supernumerary role of the ward manager is crucial for patient care and patient outcomes, and I've heard so many plans and ideas and innovative processes to make this happen. It still hasn't happened.
I would benefit from administrative support. So I find that a lot of my working week I'm dealing with admin tasks, photocopying, scanning, tasks such as that.
A lot of my time is spent in admin is quite a lot of time, and sometimes I don't finish on duty on time because I'm catching up with admin work. So to have somebody that you can delegate that to, that would be fantastic.
I rely heavily upon my deputies to make sure that the ward is covered 7 days a week. However, we work 12-hour shifts, so that only gives us 6 days a week cover. So it would be great to have some more senior support.
It's incredibly important that I have admin support, otherwise I have to end up doing another job role myself, and it can be as simple as making sure that letters are sent out, filing is done, if I need somebody to pull up a report for me, if I have to go and find it myself or type it up myself, that takes extra time, which I could be using in a better way. And having an admin staff with me to support that means that I've got more time to do the job that I'm really here to do, which is to help my patients and to help my staff provide care to patients.
So we've already got a piece of legislation for nurse staffing levels. What the Welsh Government needs to do now is make sure its statutory guidance that it says it wants the NHS to follow is actually implemented.
I mean, it's law, and what is really important is that we have the right numbers to deliver the right care to the right standard to all of our patients.
The Act relies on evidence as well as the facts of the numbers.
And that's about getting ward managers to be supernumerary and in addition.
Although it's been muted for many years, with free to lead, free to care, the Francis inquiry about clinical leaders being supernumerary, it still isn't mandatory, and I see many colleagues being swamped where I think it has to be and is essential for patient outcomes.
We currently have an estimated 1,500 registered nurse vacancies alone within Wales.
So we have to succession plan to ensure we have the career development for people coming through nursing who want to be ward sisters and want to be charge nurses.
There's an absolute wealth of evidence out there that supports the ward manager being supervisory to improve the quality of care being delivered for patients.
So we need to make it a really good career choice and we need to back that up with time for continuing professional development, time for leadership skills, time for just undertaking those duties. And of course, we need to pay them properly.
More satisfied staff will increase the retention of staff.
Pay people properly and they'll want to do these jobs. That's what the Welsh Government's got to do. It's a political decision. It's got to invest in nursing and specifically it's got to invest to ensure that its ward managers are supernumerary.
There's one plea I will make. As far as employers is concerned, can you afford not to do it?